Hello, my dear subscriber and viewers. Welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about musculoskeletal part 1. Actually, in part 1, I am going to explain fracture treatment or dislocations. Okay, in next video, part 2, spinal procedure. And next third video, arthroscopy procedure. In last video, all other main procedures, so I'm going to cover. So those who are new to my channel, please subscribe my channel, and before going to video, please subscribe my channel, and also please press the bell button also. Then only you will get my all new videos as a notification. Okay, next, let's start from the fracture treatment. So what is the fracture? So fracture definition is break in the continuity of the bone. So it may be due to traumatic or non-traumatic or pathological. So this is called as fracture. So what is dislocation? So dislocation is a displacement of the bone from its normal position. This is called as dislocation. Okay. So in what all the topics or what all the treatment we have in our CPT books, there are 4 types of CPT treatment available. So one is closed reduction, then percutaneous fixation, next ORIF open treatment, then closed treatment without manipulation. Okay, what is the closed treatment? Closed treatment, fracture site is not surgically open. So this is closed treatment. If it is surgically opened, then it is considered as open treatment. Okay, in closed treatment, we have with manipulation or without manipulation CPT code. Okay, then so open treatment means open reduction. So internal fixation or intramedullary nails they may fix. So based on this, we have the some set of CPT codes. So open means surgically incision and surgically open the fracture site. So the word incision they will do so to access the surgical site. So this is called as open treatment. Okay. Then percutaneous treatment. Percutaneous treatment means so fracture fragments are not visualized, but treatment or any wire fixing by the under the imaging guidelines, either it is fluoroscopy or ultrasound, any imaging guidelines. By using any imaging guidelines, fracture is treating or in fixing the wire means we have to consider that treatment as a percutaneous fixation. Okay, next, what is the meaning of with or without manipulation? With manipulation means physician restored the alignment manually. So this is called as closed treatment with manipulation. So fracture is manipulated back to the anatomical normal position, and they may fix the cast or brace. So without alignment of the bone means we have to consider it is without manipulation. Okay. Then what are the guidelines we have? So let's start from the guidelines. Okay. Whenever application of device they are inserting, example cast, splint, strapping, so that time itself including subsequent removal of device is included when performed by the same entities. Same entity means physician, practice group or employees, etc. So these are considered same entities. So if it is same entities means so application also performing here, and subsequently subsequent day removal of device also performing here means that time we cannot code the second subsequent procedure. So it already included in the application time itself. So if it is different entities means we can code subsequent that removal codes. Okay. Next, removal or repair code is 29700, 29750, or for those services provider supplies we cannot code it, as I told already. So if it is different entity we can code it differently. Next point, Casting, splinting, strapping CPT codes shall not be reported for application of dressing after a therapeutic procedure. Okay. Then next, this says casting, strapping CPT shall not be reported separately if the service is performed with the same anatomical area. So if it is same anatomical area, we should not code this casting 29 series code, CPT code, along with the main procedures codes. Okay. So what are the main procedures codes? CPT range 201002 to 8899. From this range, we cannot code 29800 to 29999 code. So always check anatomical area. If it is same anatomical area, same day with the same provider, main procedure, closed or fracture treatment procedure also performing, and casting also they are doing, means casting always included in the main procedure. So casting, splinting, strapping CPT codes we should not bill separately. Okay. Next point, debridement, including removal of foreign materials at the site of the open fracture or dislocation, may be reported. So what is the CPT code? This point I already explained to you in the integumentary part 1 video. So those who wants to watch this video, please check my playlist. Because always whenever open treatment, open fracture, doctor may do open treatment, that time before incision. So open fracture means already bone visibling, so skin also opened. So that time some foreign materials is there. So before doing fracture treatment, doctor may do to remove the all foreign materials at the site of the open fracture. So if it is extensively, doctor is removing all foreign materials before doing the open treatment procedures, we have to report a debridement code separately. The code ranged from 11010 to 11012. So this code we can report separately with the main procedure of open fracture or dislocation procedure. But if debridement also performing and casting, splinting, strapping also we are doing, means, so with that CPT code we cannot report debridement. So what is the main procedure? Fracture or treatment, dislocation treatment code. For those CPT codes only we have to report debridement separately. Okay. So next point is, if the ankle fracture or dislocation repair is stabilized with the strapping, so that CPT ankle CPT fracture CPT code we cannot report with the strapping CPT code. That strapping CPT code is 29581. So application of multi-layer compression system, leg, below knee, including ankle and foot. So this CPT code we cannot report with the fracture dislocation repair CPT code. So even if the strapping treats another problem such as edema or venous stasis ulcer, so for that condition, if a doctor is doing strapping, means that time also we cannot report with the main procedure fracture or dislocation CPT code. With that code we cannot report. So consider always initial casting, strapping, splinting code it included in the main procedure. Okay. Next point is CPT codes for closed percutaneous open treatment fracture, including, as I told you, including application of casting, splinting, strapping CPT code. So though both we cannot report separately. Okay. Then if physician treats fracture or dislocation with the initial cast and strapping, splint also assumes follow-up care. So provider cannot report casting, splinting, strapping code since these services included in the fracture dislocation CPT code. Okay. Next, if physician treats fracture dislocation with their cast or splint or strapping and as an initial service without any other definitive procedure, so only to perform the initial procedure we can code casting, splinting, E&M code with the casting splinting followed by the supplies code. Okay, so if it is physician settings, we can code E&M followed by the casting splinting CPT code, then supplied code. If it is hospital based procedures means, so OPPS, if the hospital treats the fracture, dislocation or with the cast or splint as a initial service without any other definitive procedure, so hospital can bill the splint CPT code. So that time we cannot code supplies code or Q series code. What is the supplies code for cost means Q40012 to Q4051. So this range code is supply code. So if it is physician office, now splint is they are performing as a initial treatment, so we can code E&M casting code, supply code also Q series HIPIX code. Okay, so the Q series is HIPIX code. So 3 codes we have to bill if it is a physician services. If it is hospital treats the fracture with the cost as an initial service without any other definitive procedure, then we have to code that casting CPT code without supply code. So this time hospital, if you are billing in for a hospital, we should not code supplies code. Supplies is included in the hospital services. Okay, then next service is 20670 20680. So these 2 codes for removal of internal devices. So removal of what is the internal fixation devices? Example, pin, rod. So these are the examples. If they are removing, they are coming only for the removing means we can code if that removal, if it is that removal of internal fixation is necessary to the integral component of the another procedure. For example, if revision of open fracture repair for non-union or malunion of bone records removal of previously inserted pin, so CPT codes 20670 20680 is not separately reportable. So whenever that removal of internal fixation, so that procedures only for the main procedures. During that main procedures they are removing means we should not code removal of internal fixation code to the with the main procedure. Though another example is if these main procedures require surgical, it is not separately reportable when performing as integral part of the another procedures. So whenever main procedures they are doing with the removal of device means, so devices in removal of devices is a part of the procedure to the main procedure. Okay, then if it is this removal or wire sutures during the cardiac reoperation procedures or sternal procedures means, for example, debridement, resection, closure of medial sternotomy separation. So during this procedure, if removal of implant performing means we should not code separately removal of implant CPT code. Okay, so whenever that main procedure is performing, removal also if doctor is doing means, so removal we should not code separately. Okay, then if the closed reduction procedure fails and it is converted to the open fracture, so if it is converted means, as I explained you in basic surgery coding guidelines, so whenever one method is failed converted to the another method, check from by which method doctor successfully completed that treatment means code only that method as a final CPT code. So if it is closed reduction procedure fails and it is converted to the open reduction procedure at the same patient encounter, so only more extensive open reduction procedure is reportable. Okay, similarly if the closed fracture treatment procedure fails and converted to an open fracture treatment at the same patient, so only the more extensive procedure we have to bill it. More extensive is open fracture. So open fracture only we have to bill. Okay. Then if the interdental wiring, the CPT code is 21497 CPT code. So this procedure is necessary for treatment of facial or other head related fracture procedures or arthroplasty or facial reconstructive surgery or other facial or head related procedure. For those procedure they are doing interdental wiring means we should not code interdental wiring CPT code with that main procedures. Okay. So if it is interdental wiring is performed unrelated to the another facial or head procedure, then we can code interdental wiring CPT code separately with 59 modifier or XU modifier. Okay. Next point is, if it is doctor is performing manipulation, joint or skeletal manipulation under the anesthesia to access the range of the motion or to reduce that fracture or any other procedure. So any other any during that procedure, if doctor is performing manipulation under anesthesia means, so that procedures we cannot code separately. So all manipulation CPT code during the main procedures we cannot code separately. It is included in the main procedures. So what are the manipulation CPT codes? 22505, 23700, 27275, 27570, 27860. So these are the codes for manipulation of under anesthesia CPT codes. So whenever these procedures to access the range of the motion or to reduce the fracture or any other purpose during the another procedure, so always it is included to that main procedure. Okay. Then next, when fracture dislocation is repaired, only one fracture repair CPT code only we have to code. So if it is closed repair or percutaneous repair or open repair codes for same anatomical site or performed means only more extensive procedure, only one CPT we have to code for one anatomical area. So open treatment only we have to code finally. If then next point is, if a single cast or strapping or splinting treat multiple closed fracture without manipulation means only one closed fracture treatment without manipulation CPT code may be reported. Okay. Additionally, if the single cast or strapping splint treats multiple fracture without manipulation in additionally to one or more fracture with manipulation. So one fracture is without manipulation, one fracture is with manipulation means, so closed fracture without manipulation CPT code shall not be reported separately. Okay. So these policies also apply to the closed treatment multiple fracture not requiring application of cast or splint. Thus, if the multiple closed fracture occurs an area that would have been treated with the single cast or CPT, so only one CPT code for closed fracture treatment without manipulation may be reported. Okay. Then if the cast or strapping splinting applies after open or percutaneous treatment also treats closed fracture without manipulation means, so that time closed fracture without manipulation CPT code shall not be reported separately. Okay. So what is the principal guidelines? So these principal guidelines is always think multiple fracture or any combination of multiple closed fracture, so that fracture treated single cast with that combination of multiple fracture, one fracture done by the without manipulation and one fracture done by the with manipulation means code always additionally with manipulation CPT code. Okay. If the multiple dislocation treatment treated with or without manipulation do not require cast or splint CPT, so for closed dislocation or fracture treatment, CPT may be reported. For anatomical area that would have been treated by a single cast or strapping. Okay, then next point is whenever manual therapy technique performing with the main procedures like anatomical region where multiple layer compression system, that code ranges 29581 to 29584. So it is necessary to indicate that manual therapy technique, it is distinct part anatomical area, we can code it with a 59 modifier or XU modifier. So 97140 is for manual therapy technique code. 29581 to 29584 is multi-layer compression system. So both procedures done in the different anatomical area, then we can code with the 59 or XQ modifier. Then if it is insertion of wire or pin with the application of skeletal traction including removal, so that CPT code is 20650. The CPT code description itself separate procedure. So this time if it is same anatomical area with that other main procedures, so we cannot code separate procedure with that procedure. If it is unrelated to the anatomical area as basic coding guidelines, we can code both, okay, with the appropriate modifiers. Then coding tips for fracture treatment. So we have to check first types of the fracture treatment, next site of the fracture, next if it is closed treatment, check whether it is with or without manipulation. Okay, then check whether with definitive procedure also performing cast or splint or not. Okay, then initial procedure where they are doing, subsequent procedures where they are doing. These are things, coding tips we have to check before coding. Okay, then let's see some examples also. So example, fracture site is tibia, left side of mid fracture of the left tibia. So what doctor is performing? Doctor taking to the operative room to perform the IM nailing procedure after general anesthesia following standard prep. Intramedullary rodding was carried out with the proximal and distal locking screw were secured in place. So incision was closed and long leg cast was applied. So in this procedure, so as per the coding tips, what is the types of the treatment? So types of the treatment, incision, that means open treatment. Okay, what is the site of the fracture? Site of the fracture is tibia, mid shaft fracture of the left tibia. So 2 point we identified. Then check whether it is along with the main procedure and cost also. So same anatomical area, main procedure as well as cost also they are applying. So cost is included into the main procedure. So cost we should not code separately. Okay, then the final code is 27759. Like this, as per the coding tips, we have to check from the operative report what doctor is performing. Okay, let's see next example. So next example is so what is the site of the fracture? The site of the fracture is not fracture, it is sprain. So ligament sprain in the left leg, left knee. So what is the treatment? Treatment is they are not doing main treatment like fracture dislocation treatment, they are not doing. So doctor is performing cast thigh to the toes. So only cast only they are doing in the ED. So only we have to quote cast only. So 29345. So that's all about fracture, guys. So whenever you are doing fracture codes, fracture scenario, check for the coding tips. Whether it is what is the type of fracture, what is the site of fracture, then whether it is cost also performing or not, or initial and subsequent care of the procedures. Okay, these are things you have to check thoroughly, then only you can read the, you have to read a question. Okay guys, that's it about fracture. And if you want theoretically, you can read my blog also. So that blog website I have pasted in description box. Then those who are new to my channel, please subscribe my channel. So this channel will be very useful for beginners, medical coding course for beginners, as well as those who are going to write CPC exams. So these all videos will be very useful to clear the CPC exam. Okay, so if anybody have any doubt, please comment. And if you like this video, please like and share to your friends also if it is possible. Okay guys, thanks for watching my video. Thank you so much.